of uterus, vagina, and in special the histological details of it. As you are looking into again the uterus like an inverted pear-shaped organ, right? So we can now observe that the uterus has got various parts. Let's see what are they. The portion of the uterus that is above the line of attachment of the fallopian tubes is called the fundus, right? And the portion below it, which is more broader, is the body. And next to it, we have got a little portion called as isthmus, right? Okay. Then we enter into a tubular or canal-like structure called as cervix. And this cervix has got two openings. It has got the internal os that communicates with the isthmus, or you can say it has to communicate with the body, and the external os, it is entering into the vaginal wall, right? So this is how you see this pear-shaped organ. Okay, another picture to elaborate the various layers. Now you can clearly see the fundus of the uterus that is above the fallopian tubes. Green lines are fallopian tubes, right? And the body then comes, then a little part, just like this, is the isthmus. Then you see the cervix with two openings, the internal os and the external os. Now from within inwards to outwards, if you observe, there is a mucosal covering that is called as endometrium, right? This is the innermost layer of the uterus. Then you see the thickened portion of it called as myometrium, right? Metrium is word for the uterus, basically a mother womb. Now the final outer layer is the perimetrium, right? So you already know that endo, myo and peri is from within outwards. These three layers are there. Now we have to discuss them in detail that when we take a portion of it and put under the microscope what we see. So let's find some other view. Okay, this is a little bit smaller picture, but if you concentrate, this is a sagittal section. And we have to learn that this organ is the uterus that is lying anteverted and anti-flexed, right? And another organ, the bladder, urinary bladder is anterior to it, and you see the rectum behind it. So we observe the reflection of peritoneum behind this bladder and anterior to this uterus covering it and then on its posterior surface and then again on and above the rectum that you have already learned in the lesser greater omentum and the peritoneal reflection, right? So that was important to show you the relations. So let's see some other related picture. That was a repeat. Yeah, that was about the blood supply of the uterus. As you have seen that there were broad ligament on both sides, and on both sides you can observe the entry of uterine artery from one side and from the other side, from the lateral aspect, right? And then it has to give rise to the arcuate artery because it is giving an arc. Then this arcuate artery is supposed to give the radial branch towards the deeper portion of the uterus, right? Again, it has to divide into two sets of arteries and later on arterioles. First set is called as this straight artery, right? It has to do the straighter course, and the other artery is the spiral artery in the form of a corkscrew, right? And it is ascending upwards and upwards and will cover the whole mucosa. So let's see here the details of the endometrium or mucosa. From outwards, you would say, or the surface layer, which is the surface epithelium, simple columnar epithelium being lined with this gynoecilia here and consists of two types of epithelial cells, the simple columnar cells and the secretory cells, right? And you see these secretory cells well placed in the deeper part of these glands. So these glands which are you are looking into could be simple tubular or could be branched as there is branching is shown. And what else is there? That you can observe that this lamina propria is well laden or is showing high cellularity. May be laden with various lymphocytes, macrophages, fibroblasts, so many cells you can observe here, right? And the well vascularity as you are looking into it. And what else? There is an important thing that we divide this layer into two basic divisions. The superficial two-third portion is called as stratum functionale or functional layer, right? Because it has to be shed off, right? Then we observe the lower one-third, which is stratum basale or basal layer. That has to be stayed inside and it is not being shed off, right? This is the basic difference. Again, much denser, more cellular, and you can see the arrangement of blood vessels. The special thing is that the straighter artery, they remain in this basal part. They will not move upwards, right? And the spiral artery will reach towards the full thickness of the stratum functionale. So how can we learn that you can say something is straight, so remains at the base, right? And something that is spiral, that is wavy, that is cunning, has to reach towards the superficial show-off area. Just to remember, right? Because we have to learn this. So this is the basic arrangement we will see. Now let's see some other picture. Histological sections. Okay. This is again a schematic representation of the uterine wall. And again you see that this upper portion is the stratum functionale, which is two-thirds, and lower one-third is stratum basale. And next, you enter into the myometrium, right? This myometrium definitely made up of muscular layer. So you can quote them as inner circular, middle longitudinal, and this again. Or rather, you would observe these, longitudinal, inner, and outer and middle circular, but as a interwoven and intermingled, not at a distinct or separate layers. Rather, they are in a random fashion. Because we have already mentioned that there are few organs in our body which are hollow organs and they address various random arrangement of muscular tissue. Can you please name them? Can you recall? Yeah, stomach, urinary bladder, gallbladder, and the uterus, right? So this is one of the place where you get this. So the muscles, we can see here that in pregnancy, the number of this muscle, it becomes very high. Rather, we observe hypertrophy and hyperplasia as well as. So both features are seen here in this smooth muscle category, right? Okay, and if we observe there is another layer that is perimetrium, and it would be observing as the serosa in general, right, on the superior surface of most of the surfaces, but anteriorly and lower half of the uterus being covered by the adventitia, right? Okay. Now, last time we discussed the ovarian cycle. So you should know that these cyclic changes are under the control of all the gonadotropic releasing hormones and then the gonadotropic hormones like FSH and LH. So always keep in mind that there is a center called hypothalamus to deal with it. Then you enter into the anterior pituitary, right, to regulate. And they get the target organ. So target organ was ovary. And as we know that ovary also behaves as an endocrine organ, it has to produce the hormones, and these hormones are acting upon the uterus, the uterine wall. So it is the endometrium predominantly, definitely the rest of the myometrium as well, they are showing the changes under the hormonal control. So let's see what's going to happen. The phases of the ovarian cycle were the follicular phase, in which the follicle was supposed to develop and pass through different stages of maturation and differentiation, right? Was it? Then there were ovulation, and we enter into the luteal phase because of the corpus luteum, right? Now what we see here in the uterine cycle or menstrual cycle, that initial 3 to 4 days are the menstruation phase or bleeding phase. Later on what happens? The endometrium, it becomes thin, just like a thinner band, because the functional layer is being shed off. The basal layer that remains. And the next phase which we learn is the proliferative phase, that is under the control of estrogen, that will regenerate it with the help of stratum basale, right? The stratum basale and its cells, fibroblasts, they will produce the collagen fibers in it, they will produce the stroma, and definitely under the control of this estrogen that is acting upon all the changes like the growth of the remained arteries, we will see. Initially there are what we were observing in the basal layer, which arteries? The straight arteries, and the initial segment of definitely the spiral arteries, right? Now they have to regrow, and as well as the gland. So keep in mind, because it was just in the form of a thin band when the proliferative phase started. But when this proliferative phase will reach before the ovulation start, it will attain its maximum thickness up to 3 mm. Is it clear? But initially it was thin, now it is regrowing along with the growth of the blood vessels, and the glands are also, you can see, again well formed, and the surface epithelial cells not only covering this glandular tissue, but also the denuded or naked surfaces, they are also putting the epithelial lining over it, because all the regenerative changes occurring here. So can we call this proliferative phase as a regenerative phase, right? So on the top we are observing the ovarian cycle's follicular phase, which is secreting predominantly estrogen to act upon it. Okay, after ovulation, which was on the 14th day, with the help of the LH surge, if you can recall in the previous, the ovarian cycle, we will next step into the secretory phase, which is now under the control of this progesterone secretion by the corpus luteum, right? That progesterone is now meant for the further growth of this endometrium. Now you can see that the arteries now attain a full length and reaches up to the full thickness of this stratum functional. They are now taking the well spiral course. They are being resembling with that of the corkscrew, right? And the glands become tortuous, well marked, right? And the stroma will become much more edematous, right? Because these glandular tissue and epithelial lining cells, they are well laden with the granular secretion inside, because they have got the secretions. If implantation of the fetus occur, they have to provide the nutrition for it, right? So they will attain the full thickness up to the 6 mm. So up to here in the follicular phase, it was just 3 mm after regeneration. But later on, it attained up to the thickness of 6 mm, means double to that of the proliferative phase, right? So that secretory phase is showing well marked, tortuous, wavy, the glands and the spiral arteries and the edematous stromal tissue intervening. Okay. then the corpus luteum is producing the progesterone, and no doubt the estrogen, they are taking it. But if there is no fertilization of the ovum being released, after almost 10 to 12 days, the corpus luteum will not function or will not secrete the progesterone, right? Now, what happens that the level of the progesterone in the blood, it decreases, and what happens that there will be the, after that, ischemic phase starts, in which there would be the vasoconstriction of the blood vessels, right? Because they have to now shed off. So 1 to 2 days they will be in the vasoconstrictive phase, and then suddenly they will be showing the vasodilatation. And then the stuffed off part of the endometrial tissue and of course the blood, all the cell, they will be shed off in the menstrual phase, right? So this is how the cyclic changes are being repeated. And you should be knowing that which layer is going to be shed off, and the basal layer will persist here for the purpose of regeneration, right? Is it clear? So if the question comes about the description of the uterine cycle, you have to mention all these four phases. Get in mind, right? Under the influence of these hormones being secreted by the follicles, which were being matured in the ovaries. But if the question comes just to ask you the ovarian cycle, so you have to focus on the follicular phase. The definitely ovulation you will mention in the both in detail, and the luteal phase. Is it clear that the ovarian cycle is different from the uterine cycle, but they go side by side and simultaneously? Is it clear? Okay. So it means when your this chart is showing two type of phases, in histological section we also see the two phases. Let's see what they are if you find them. Yeah, that was a proliferative phase. We can see that the glands are taking the straightened course. And when you take a cut section, their rounded or little bit oblique sections are under observation. That is the thing we can observe in the proliferative phase or follicular phase. Yeah, this is still uterine wall, but that seems very tricky or different. Now what is going to happen? That the straightened uterine glands are now taking the tortuous or wavy course. Can you see that? So it means it is not a pathology. It is just the change of the phases that are taking it, right? So again, you can see so many well-vascularized blood vessels, much dilated, and all the cellularity you are observing in the lamina propria, but the predominant thing that the wavy and tortuous glandular cut sections are there. So this is how you will learn that we are in the secretory phase, or again let me show you the proliferative phase, right? So keep in mind that these are normal physiological changes we are observing. There is nothing that is being pathological. So let's find some other pictures. Yeah, this is a phase, which is a waving phase. You can see that the glands being torn out and there is spill out of the endometrial tissue. Again, another picture to show you the blood vessels, the uterine artery, again giving rise to an arcuate artery because it's taking an arc. Then radial artery. Then you can see this straightened artery, which are just staying in this basal layer because they are straight. See, these arteries, they are on the base, right? And the spiral artery taking a tortuous course and they are entering on the top. And again, you are seeing another thing that the mother womb, if there is later on fertilization, implantation of the embryo. So we can observe various capillary network and the lacunae filled with the blood for the supply of that fetus. Okay, that was again the phases in the chart form, just make you remember that you categorize that there is the follicular phase, you can do right there. and then comes the secretory phase. They have added that luteal phase. So you can write it as a follicular phase as well for your remembrance, right? You can write here the parameters that what we have to mention. The main pituitary hormones which are FSH, that is giving the initial growth of the ovarian follicle, or we can say that the ovarian follicle growth is prompted by FSH, right? And what is going to happen here when the secretory phase come in? The luteinizing hormone at the beginning will definitely induce what? The ovulation, and later on the formation of the corpus luteum. These are the main events taking place under the influence of the pituitary hormones. So next to it, what happens in the ovary? The growth of the ovarian follicle we see. And the dominant follicle we see that will attain the tertiary follicular stage or pre-ovulatory. We have learned ना कि जो ताकतवर है, जो dominant है, वो जिंदा रहेगा, वो सारे phases complete करेगा and will reach the pre-ovulatory stage in the ovary. And what three things in detail or important are happening in the secretory phase? First comes the ovulation, later on the formation of corpus luteum, and we have seen the degenerated corpus luteum, right? Because the cycle has to again start. Then the hormones inside the ovary, the estrogen, which is meant to grow or taking part by this release through the growing follicles, now act upon on the uterus, the fallopian tubes, and the vagina, of course. And the progesterone, which was being secreted by the corpus luteum, has to predominantly act on the uterus. Why it is being written? Basically, when we observe that uterus has body and the cervix. So what differences we can make in the form of the chart from the uterine body on one side and the cervix? We can see that uterus is a very broader, hollow body, but the cervix is like a canal. One difference. The other that the endometrial changes occur in the body but not in the cervix. Means the endometrial layer is not going to shed off in the from that of the cervix. So endocervix will remain over there. And whenever there is progesterone secretion, uh, progesterone secretion will cause the inner glandular secretion in the cervix into two phases. When it is in the proliferative phase, it will be more watery, and when it will be in the luteal phase, it will become more viscous, more mucus in its secretory type, right? So these changes. And gland, we observe simple tubular gland predominantly in the body, but it could be branched in the cervix. So it means that if a question comes that compare contrast the differences among the body of the uterus and the cervix, so we can quote easily. And the cervix definitely are well laden with the elastic tissue, much more elastic tissue and few smooth muscles. But in contrary to that, the body is well marked with the myometrium area. Smooth muscles are in maximum amount, right? So these are few differences you can add. Other changes you can see that what happens to the mucosa and the glands and the other things. Okay. This is another diagram. We schematically, I think, learned last time that there was the ovarian cycle phase, and then you can draw the chart of the four hormones, FSH here, and the estrogen and progesterone. The estrogen is showing two peaks, and the progesterone is showing the peak secretory area in the this luteal phase, and below you can observe the uterine cycle changes there. Few more diagrams let me discuss. Okay, you are now looking into the vaginal wall. You have seen first year for the stratified squamous epithelium. So it is a very broader epithelium we have ever observed, which is stratified squamous but non-keratinized, because we know the rule that whenever the stratified squamous epithelium is there, when it is on outside of your body in the skin, it becomes keratinized, but when it lines your inner body tissues, it is non-keratinized, means the nucleated layer is there, much wider. So normally there rests or lies always a bacterial flora inside our body. Same happens here. So these cells are well laden with the glycogen content, and when then the bacteria that interact with it, it converts this glycogen content into lactic acid. So what happens? The pH of this epithelium becomes more acidic. When it becomes more acidic, it protects from various pathological organisms, right? So next to it, they are resting on the basement membrane, the darker line you can observe, and next to it, you observe the papillary projections from the underlying connective tissue. And again, if we see, it is being there is the muscular layer, which is again inner circular and outer longitudinal in the vaginal wall, again interwoven, right? And this is what is not lined with any glands. So no glandular tissue observed here, rather the secretion would come through the cervix. Okay, if any other diagram related we have to discuss. That was again a diagram of the vaginal wall, the thickened stratified squamous epithelium, then the lamina propria, again showing the vascularity, the plexus of the veins, and the nerve plexus could be there. And if the lymphatic tissue you find here as well. And then the interstitial connective tissue definitely there, and the smooth muscles in the form of longitudinal bundle, transverse bundle, but they are interwoven, and intervening elastic tissue is also well laid there. And finally, it is ending up with the adventitia, right? Okay, this is in repeat. So let's see some slides related to it. Yes, slides are lighter state, so kindly. Okay, you help me that which slide it could be. Yeah, this is uterus. Very good. We are looking into the endometrium, the surface epithelial cell, simple columnar. They are dipping down to form the simple tubular gland. There could be branch in the depth. This whole portion is lamina propria, right? Well, cellularity. When the word lamina propria or connective tissue comes, you should keep in mind all the features that cells could be there, the ground substance must be there, and the fiber content is there. Okay. You can see the stratum functionale, a little bit lighter stain if you observe. When the stratum basale comes, it is much denser, much more cellular. Then we suddenly jump into myometrium, right? Myometrium is showing various lumps of the muscle tissue, and of course, we'll be addressing much vascularity. Can you see so many cut section of blood vessels in the middle of the myometrium? And that very middle region of the thick myometrium is called as stratum vasculaire. ठीक है? इतनी चौड़ी इतनी बड़ी है, उसके दरमियान में इतने ब्लड वेसल्स हैं कि उसको एक डिफरेंट नाम दे दिया गया है कि stratum vasculaire. So keep in mind why this muscular tissue is having this much blood supply and a different name is given. All this cut sections are of blood vessels. And finally, we are entering or ending up to the myometrium. There is unfortunately no layer of the serosa or adventitia. If it is there, we can well observe. So this much thick on 4x. See, this is the myometrium. Still we are in the myometrium. Still we are till we reach the this glandular region. This is the stratum basale and this is the stratum functionale. Right? This is how you will learn. Now, if it comes in the OSPI, you have to write that this is the uterus, one thing, and in the bracket you have to write this is the proliferative phase. So let's see about the secretory phase, what changes are there. From one end we have to start searching. This is whole myometrium. Let's see how we'll be able to differentiate. Let's find one end. Yes. Now this is endometrium. Okay, can you see that? This is from inwards to outwards. This is simple columnar epithelium, and you can see these are so many tortuous, wavy cut section of the same gland. Can you see in the last, the proliferative phase, very straightened, coarse glands we are observing. But again, we are still in the uterus, but now you can see the torsity and the spiral fashion, blood vessels and cut section, right? So this is the stratum functionale. Now we are in much closer area of the glandular tissue. So this is stratum basal, right? We are moving from inwards to outwards. That is why it is in depth. So this. Now see the this myometrium, thick mother womb showing so many muscle fiber randomly arranged till we reach. These are again an area showing the well vascularity, again the blood vessel, and finally we are reaching up to the end. So this much thickened the myometrium of the uterine wall. I think this you also must have seen in first year for the smooth muscle, that you have learned that they are in the whorl pattern, they are in the random fashion, but now you are learning as a whole tissue. So we have to concentrate, or we will focus the slide if it comes in your OSPI in this region. So you have to write the uterus, right? But in bracket you will write the secretory phase. Okay. Now the last slide we have to see. Okay, this I think again you have seen, must have seen in the first year, to learn the stratified squamous non-keratinized. The mucosa of this vaginal wall is being thrown into various rugosities or foldings, right? And this much is the width of this epithelium, right? 100 to 200 micrometer. And this hole is the stratified squamous non-keratinized epithelium. And just below it, we enter into the muscularis externa, in which inner circular layer and the outer longitudinal, they are interwoven rather. And finally, we are entering into this loose connective tissue layer, which is adventitia, right? As no mesothelium is there, so we won't say that it is serosa. So it is adventitia here. So see, in exam, when we focus this thing, the mucosa is being thrown into various foldings, you will do write it as a vaginal wall or vagina. Is it clear? Okay. Thank you very much.